Hi friends! If you've ever had trouble managing feelings and emotions as a result of a traumatic experience, then this video is for you. Today you will learn about 8 different types of coping skills to help you manage trauma symptoms. Coping skills are things you can do to help you better manage thoughts, feelings, and behaviors that arise after a traumatic experience. They help you calm your brain and body, think more clearly, and develop inner strength to overcome your past trauma. What is trauma? Trauma happens when we are exposed to a very stressful event or series of events that we find extremely distressing or emotionally painful. Some common causes of trauma include abuse, neglect, family fighting, bullying, loss of a loved one, witnessing or experiencing violence, or anything that causes us overwhelming fear for our safety, health, or well-being. What do we experience after trauma? Trauma can make you feel many different uncomfortable feelings, such as confusion, anger, sadness, anxiety, fear, or low self-esteem. It can also cause you discomfort in your body, trouble sleeping, trouble concentrating, negative thinking, impulsive or negative behaviors, or withdrawal from others. The following are 8 different types of coping skills to help you manage trauma symptoms. Number 1, relaxation skills. These are things you can do to relax your brain and body. Examples of relaxation skills include deep belly breathing with long out breaths, tensing and relaxing your muscles, visualizing a peaceful place, taking a warm bath, massaging your neck or shoulders, or using a relaxation app. Number 2, grounding skills. These are a type of relaxation skill that help to ground you in the present moment, so you don't stress about the past or the future. Most grounding skills involve taking deep breaths to calm down and then focusing on an activity using one of your 5 senses. Try the 5-4-3-2-1 grounding skill, where you take a moment to notice 5 things you can see, 4 things you can feel, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. You can also try the 2-4-6-8-10 grounding skill, where you tell yourself 2 kind or encouraging statements, take 4 square breaths, imagine 6 different foods you enjoy, tense and relax 8 different muscles in your body, and find 10 items in the room of a particular color. Number 3, mindful distraction. When experiencing trauma symptoms, be careful not to simply escape your problems in daily tasks by spending time with unhealthy distractions. Instead, practice mindfully taking breaks to calm down or engaging in healthy and uplifting distractions so you can return feeling calm and under control. Examples of healthy distractions include removing yourself from the trigger, reading a book, watching a funny movie, playing with a pet, doing a puzzle, or engaging in creative outlets such as art, writing, coloring, music, building, or any other hands-on activity. Number 4, shift your mindset. This involves noticing when you have negative thoughts about your situation and then practicing more productive or helpful thinking. You can do this by challenging your negative thoughts, using coping statements to coach yourself through the difficult situation, practicing gratitude, or adopting a growth mindset. Number 5, physical or emotional release. These are things you can do to move your body or express yourself to release your negative emotions. Examples of a physical or emotional release include exercising, taking a cold shower, letting yourself cry, dancing, yelling into a pillow, stretching, yoga, or martial arts. Number 6, ask for help. Asking for help takes courage, but just like any skill, it gets easier the more you do it. Turn to caring friends, family, or teachers for support. Talk to a therapist or counselor. Meet with a doctor or psychiatrist if your trauma symptoms are severe, and don't go away with other coping skills. Number 7, self-care. Self-care is anything that helps you take care of your mind, body, and emotions. Self-care includes practicing good health habits such as eating well, sleeping well, and exercise, practicing self-love and self-compassion, following a daily hygiene routine, drinking plenty of water, and getting out in nature. Number 8, build your resilience. Resilience is your ability to cope in the face of challenges, stress, or trauma. A resilient person is able to bounce back and get stronger through difficult times. Resilience is a learned skill, so anyone can develop it through good habits and positive mindsets. Skills that help you develop resilience include setting and working towards goals, using problem-solving skills, discovering your passion, practicing optimism, practicing flexibility by letting the little things go and accepting the things you cannot change, and keeping a hopeful mindset that something good will come from all your efforts to improve. Some people who experience trauma feel shame, embarrassment, or guilt. It can be helpful to share your feelings with a therapist or a caring adult and take care of yourself to defend against these thoughts and feelings. If you've been through a traumatic experience, it is important to remember that what you experienced is not your fault. Overcoming trauma is a process that takes time. Be kind and patient with yourself. The coping skills taught in this video are a good starting point on your journey toward healing and recovery. If you found this video helpful, please like, share, and subscribe. For more social, emotional, and mental health resources for kids and teens, please visit www.mentalhealthcenterkids.com. Thanks for watching!